Good morning, ladies and gentlemen. Welcome to Lifestyle with Dr. Moby. I'm Dr. Moby, and today we have great guest, Dr. Jamil, once again joining our show. Let's welcome Dr. Jamil. Dr. Jamil, welcome.
Hello, this is Jamil Ahmed from Indiana, Pennsylvania.
Okay, so tell us about yourself a little bit.
I'm an internist and also a geriatrician. So I deal with geriatric problems, like a lot of things, like falls and the issue with the memory. Mm-hmm. And there's also a problem with a headache. Although we don't think that headache is an issue, but in your clinical practice, you see that people come with a headache and you have to keep an eye on it because this headache can be much more sinister than simple headache like a young people have. So, that's why my interest is, one thing that is important to know that there's a difference between men and women. Women get headache more than men. And if you take like age between 21 to 34, 34, 92% headache will get better as you get older. And at age 70, 10% of the people will complain of headache or migraine in female, only 5% for men. But there's a difference between migraine in men and women, and also age. So typically, you will have a complaint of nausea, vomiting, blurring of the vision, light insensitivity in a migraine. But in late onset migraines, it is different. Only 50% people will complain that they have a headache, and even if they had a headache, it's not that strong like the young people. They have strange symptoms, like they will have a blurring of the vision. Sometimes they may have transient vision loss. Slurring of the speech almost looks like patient is having stroke, and often they end up in emergency room to be checked out for stroke. Like confusion, unexplained, that gets better itself. Sometimes we may think of seizure. And the weakness of the arm, like a real weakness. And hearing loss, tingling, and the clumsiness. If that part of the brain is involved in this migraine, they can have trouble walking and being clumsy. So it is very strange for the family to deal with it because they're not used to this thing. And treatment is easy, like any other migraine. First, you have to diagnose, is this a migraine? Then you treat them with a Inderol that you use for other migraines, and the Depakote or a topiramate. Any medication that is good for migraine will also work for these people. So important is to diagnose.
Also, tell us a little bit about warning signs which anyone should be worrisome for. So let's differentiate those kind of, some of common headaches variety versus dangerous signs.
Yes, that's a good question. Some people have that type of aura and things like that, but a lot of people may not. And in older people, that is more common because they will have no symptom other than slurring of speech. Or they may have a headache, but not very prominent. That's not their main complaint, or trouble with the walking. But one thing that you will have trouble with, if somebody come to you and complain that I have the worst headache in my life, nobody should ignore this because usually it is something bad happening. It's sharp, it happens quickly, and it gets worse within a minute. Then you have to rule out, make sure that they don't have a subarachnoid hemorrhage or a bleed inside the brain. If you do the CAT scan and you see that, everything looks okay, then you have to rule out, make sure that you're not getting a brain infection or having a blood clot in the some of the veins in the brain. So sudden onset of a headache, severe headache, is always something that to be aware of. And patients should know that if that happens, then you see a doctor, go to the emergency room quickly because you cannot wait. Next thing will be probably the tension headache, which is probably most common. In like a 25 to 35% of the cases, that is the incidents that have happened. In older patient, tension headache can happen. And usually it stays for a brief period of time. Sometimes it stays for long weeks or few weeks at a time. But like migraine, it will not have any nausea, vomiting, or light sensitivity. So that's one way to separate that. It may not be migraine, something other than migraine, and tension, things like that. So you have to tell them that, you have to relax, you have to sleep good, go to bed early, and join some exercise program to relax, do some yoga, and there is some medication that you can take. And it is not serious disease, so you have time to think about what to do. And you can talk to a doctor, and they will tell you that, probably you have to know how to relax and relax your tense muscle. That also can help with your headache. That is most very common in older people. There's a strange headache in older people happens. They call hypnic headache. So they complain that, I woke up with severe headache, and this happens almost every day. It usually starts at over age 60. And we are not sure exactly why it happens. They have to make sure that the patient is not going through the drug withdrawal, or having infection or inflammation of the blood vessels in the temporal area. Treatment is difficult, but sometimes it responds very well with a caffeine. So if they drink 2 cups of coffee or tea before they go to bed, they may not wake up with a severe headache. There are other medication like ibuprofen you can try, and there's serious medicine like atenolol, is a blood pressure medicine, also good for migraine, also works in this situation. So there's a few things you can do, but simple thing to do is to recognize that, you wake up every day in the morning with a headache. It may be a kind of migraine, but you have to make sure that's not a brain tumor. Brain tumor people also do that. So that needs to be ruled out before you tell them that, don't worry about it, it'll be okay. Next thing, you probably think of head trauma. As you get older, one thing happens, we fall. If you think people over age 65, 30% people will have fall in 1 year. If you have dementia, you may not even know that you have fallen. You have fallen, hit your head, and you may have a bleeding in the brain, and then you complain that I have a headache, and family will not know. For those people, you need a CAT scan. And anybody who has a unexplained headache in older people should get a CAT scan to make sure that they don't have a subdural hematoma. Especially if you're on a blood thinner like aspirin, Plavix, or a Coumadin or warfarin, or a newer kind of blood thinner which is pretty strong. If you have a fall and hit your head, ask for some attention, because things can really go bad quickly, and it may take some time to get bad. One thing will happen with this type of headache, that if you cough or strain, you tend to have a little worsening of the pain. Dr. Moby, do you have any question?
With the fall, there's actually a pretty good discussion. So what you're saying is people with dementia, they might have multiple falls, they might not realize, and the
Yes,
caregiver. So, we have to examine them a lot and also look for altered personality. If their personality change, then we should look for that cause. Maybe they do have, and like you said, it's very important to make sure look for warning signs. If it's your worst headache, yes, it's concerning. Same stands for, if the headache is associated with neuroscience, like they're getting numbness persistent or loss of speech, which can also happen with complicated migraine, but each were worrisome. Same, dizziness or different aura or different symptoms, and that always bring concern whether it's something else going on. And not to mention with COVID now, headache is one of the symptoms with
yes.
fever. So fever, headache points towards infection. And we're talking also about all other kinds where they can have even sleep apnea, and then that would cause some of
Yes.
the headache problems for a lot of patients. We get manifestation, recurrent headaches, and those are also, then there is also variety with sinuses. You can have chronic sinusitis, and they can get a CT scan and see if it's a sinus is an issue. I think most common confusion I get from patients is about sinuses versus migraine. So, and I'm sure you see that too.
Yes.
So a lot of time they will say we have actually sinusitis, but actually they have migraines or vice versa. So those we see. So tell us also about some of those um, headaches, what are the treatments or what are the common factors that can make it worse?
So if I have to pick up another kind of headache,
Hmm.
that would be probably temporal arteritis,
Yeah. Hmm.
which is an inflammation, and it gets people when they're older. Young people rarely get temporal arteritis, and it's a serious condition. It's a severe headache, and it's the inflammation of the blood vessel. And problem is the type of headache that if you don't do nothing and suffer at home, you can end up with having a blindness in one eye, and and then you can lose the other eye too. So you can go completely blind if you're not treated. It is very simple to test. You do a blood test to see whether you have inflammation. You can do the biopsy of the blood vessel, and you can tell that you have a temporal arteritis. If biopsy report is not conclusive, you still treat them as severely as if he has the disease. Treatment is high dose steroid, then continue for several months, then try to taper off to see whether headache gets better or not. And you also follow their blood level for like a CRP or SED rate, which will give you some clue that the disease is getting dormant or not. These people also complain that, uh, I have a pain, sometimes one side or both side, or they have a jaw pain from chewing. That's the one clue that we always ask. Do you have a jaw pain when you eat? And they will say, yes, I do. And it might help you to diagnose it quickly and not just treating them with the ibuprofen or Tylenol, because it is a serious disease. Nobody should miss it because complication is very drastic and life-changing. Another thing that we also see called trigeminal neuralgia. It's a sharp pain on the one side of the head and can also get in the face. And it is triggered with, like if you brush your teeth and all of a sudden you have a severe pain. And or chewing, you have a severe pain in the knife going through your head. Usually those are temporal arteritis. And you have to make sure that it's not temporal arteritis. And also you have to do a scan of the brain to make sure there's not a tumor pushing on the trigeminal neuralgia. If that is the case, it's a surgical issue. Otherwise, you can treat with a medicine to control. Only 30% people will actually need surgery because nothing will help. And so you have to make sure that it's not trigeminal neuralgia, and you try all the medication like a Tegretol or a Dilantin, Depakote, and there's a lot of medication nowadays you can use it, and it all has some efficacy. So if you diagnose, treat them well, because it is not a little pain. People will just be in agony. Another cause for agony in the people is called post-herpetic neuralgia. If you have a shingle, and not everybody will have a shingle, but people who had a chicken pox when as a kid, usually they didn't get a vaccine or something like that, they will have, some people will have actually a recurrence of the infection that they had in the spinal cord and going all the way to the nerve. So you'll see the blisters on the skin, they call dermatomes. And pain is severe. And when you have a shingle for no reason, you have to make sure that from some reason your immune system is not down. So those people tend to get, if some of the cancer, like a lymphoma, first thing probably you'll know that patient had a shingle. Then HIV, people have a transplant, the immune system is depressed, or getting a chemotherapy. These are all risk factors for a recurrence of shingle. And you can get a shingle shot, and nowadays it's almost 98% efficacy. So everybody should get a shingle shot if you didn't have a shingle yet. Even if you have shingle, you still can get it, because you don't want to have a pain from shingle, because this post-herpetic neuralgia is excruciating. That's probably all the headache issues that people get as they get older. If you want me to summarize, I can give you some tips now.
Yeah, go ahead. And I think it'll be good that for audience, since we are approaching towards the last few minutes to summarize, so let's tell them. And also for migraine, also it can run in families. If you have family history, there's more likely chance you will get headache.
Yes.
And then triggers of migraine, those are also, I see, that we worry about those a lot sometimes, though can happen with the problem with migraine. So those are always a concern. That could be a family history, or it could be there's some triggers. Certain people eat Chinese food, or maybe their sugar is too high, or they eat gluten, that can trigger those headaches. So that they have to be careful with those triggers. Yes, go ahead and let's summarize for audience sake.
To summarize, you have to find out whether this is serious or not. Everybody gets headache and gets better. There are 7 signs that you should probably remember when somebody having a headache and whether it's serious or not. Number 1 is suddenness. If you never had a headache and all of a sudden you have a severe headache, it is not good. Or if you tell that, my God, I have the worst headache of my life, even if you had a headache before, then it's a clue that probably should be taking it very seriously. If you are a blood thinner and you had a fall and have a headache, yes, you should be careful that something serious is not happening. It may have time or days before you'll know that something really bad is happening. So if you get it early, you can fix it. Another problem will be if you have an immune system issues, then you are at risk for shingle. So if you have a issue with the immune system, please get a shingle shot they call Shingrix, which is pretty effective. And the age over 50 is always the time, the first time you have headache, age over 50, it is something should not be neglected. Another issue is probably pain in the back of the head and traveling down the neck. It is also something interesting happening into your brain. So I think that's all I have for today.
Okay, great. Also, just for audience sake, I just want to also educate that once we have diagnosis, or clinical suspicion, we can do additional testing, and which includes CT scan or MRIs. Now, the CT scan we do to see if there's a structure problem, sinus issue, and blood. If there's a bleed there, this will show up, or a mass. So those things will show up with the CAT scan or CT scan. Then we have more advanced testing, which is MRI of the brain with or without contrast. There are different things which each entity will cover. So the MRI without contrast is good also for certain strokes, and also they can add a contrast that can pick up fine details of white matter and gray matter. And
Yes.
those can really do more localization of if somebody has a stroke or so forth, then or a mass, then it can define that if we need to do or put a contrast. But make sure discuss with your doctor, see neurologist, see provider, and discuss what is appropriate testing. If it's infection, of course, we worry also a lot about meningitis and so forth, especially certain age groups. And make sure to get it checked. If you have fever, better might need even lumbar puncture or take the fluid out from the spinal cord area and then analyze it if there's infection. Also, there could be meningitis or encephalitis. Those are important consideration, but we just want to make sure discuss with the provider and let them make the appropriate call on those. And thank you once again for watching our show. This is Lifestyle with Dr. Moby. I'm checking out with Dr. Jamil. Dr. Jamil, any more final thoughts before we say goodbye?
I think I have given enough, and headache should not be taken lightly, especially when we get older. And when you're younger, you can neglect, but it's better
Thank
to
you
be
for
safe
watching.
than sorry.
Yeah, thank you for watching our show, and goodbye. Thank you.
Thank you.